Fifth disease is a benign common childhood disease that occurs in localized outbreaks, most commonly during late winter and early spring. Generally, the disease affects children between the ages of 4 and 10. The initial symptoms of fifth disease are mild and can include low-grade fever, nasal inflammation, headaches, and gastrointestinal complaints. Generally, the symptoms of fifth disease progress in 3 stages. It begins with an erythematous facial flushing, accompanied by the initial symptoms mentioned earlier. Once this rash becomes present, the individual is no longer contagious to others. After a period of 1 to 4 days, the itchy rash then spreads down to cover the trunk and upper and lower extremities. This can occur over a period of 1 to 6 weeks. As the rash clears, it becomes lacy or reticulated in appearance, and this can last up to 3 weeks. The extent to which the rash persists is affected by exposure to elements such as heat and sunlight. Fifth disease is caused by a parvovirus B19 infection. This virus is transmitted through exposure to contaminated respiratory droplets emitted during talking, coughing, etc., or blood products. The symptomatic development period can be as early as 4 days and as long as up to 21 days post-exposure. However, generally the symptoms arise within a week. If fifth disease is left untreated, the worst-case scenario would be for a pregnant woman to contract the disease. Seeing as this disease is a viral disease, if it were to spread to a fetus in development, it would put the baby at risk of severe immune deficiencies and even death. Individuals that may have underlying immune deficiencies and develop fifth disease are also at a higher risk of developing chronic arthropathies, which are joint diseases and dysfunction, as well as other deficiencies such as severe cytopenias, which involve a reduction in the blood cell count. This reduction in blood cell count can be fatal if the individual were to contract another infectious disease, as their immune system would be severely compromised and unable to respond. The best case scenario of fifth disease left untreated is simply that it disappears and the symptoms cease. Most people with a healthy body and immune system will be able to fight the virus naturally by themselves. This is achieved by the body's immune system using antibodies and specialized cells which attack and suppress invading pathogens. This outcome is the best as there is no medical intervention required, just the body's natural immune response. Due to the mild nature of fifth disease, treatment is often not required. The type of treatments given to children infected by fifth disease depends on their age, overall health condition, medical history, ability to tolerate specific medication or procedures, expectations on outcome, as well as opinion or preference by the physician or parent. The most expensive treatment would be available for the most severe cases. Immunocompromised patients require the most expensive treatment, which is intravenous immunoglobulin treatment. The cost of intravenous immunoglobulin treatment is said to cost about $30 per gram in the United States in 2004, and a person would need roughly 2 grams per kilo of their body mass. This treatment contains antibodies which assist the body in fighting the parvovirus B19. Research done in 1994 provides evidence that intravenous immunoglobulin is able to remove the DNA of the fifth disease virus. As of 2016, there is no available antiviral drug for fifth disease. Most people infected with the disease that have a healthy body will not need to consult a physician and will generally heal naturally, as mentioned before. We would recommend, in most cases, that the best approach to treating mild fifth disease is to allow the body's immune system to respond to the virus naturally. This recommendation is based on evidence from research trials, particularly in a research trial conducted with a group of volunteers presenting with the parvovirus B19 that causes fifth disease. Almost all developed detectable antibodies that lasted for 2 to 3 months. There would be several health professionals involved in the process of treating fifth disease and its side effects. 2 of these key health professionals include a general practitioner and a nurse. The role of a general practitioner in the treatment is to diagnose the patient and monitor their symptoms. If the patient is experiencing joint pain, a GP may prescribe a non-steroidal anti-inflammatory medication. A registered nurse would be responsible for providing erythrocyte transfusions to patients who are at risk of transient aplastic crisis due to the present anemia and the toll that parvovirus B19 infection places on the bone marrow.